Picture this. You wake up one morning, right? You've got that all too familiar heaviness deep in your lower belly. You head to the bathroom, sit down, and you wait. And wait, nothing happens. You push a little harder, and still nothing at all. Now, you might just brush it off as a minor bug, but by the third or fourth try, you realize something has shifted. Now there's real pain. It's this deep, dull, throbbing ache that just radiates from your lower back right down into your pelvis. You're feeling bloated, full, maybe even a little feverish. And that quiet little voice in the back of your mind, yeah, it's starting to whisper that something is seriously wrong.
Welcome to The Explainer. Today, we're diving into a medical mystery that millions of people, especially adults over 60, deal with, but let's be honest, absolutely nobody wants to talk about. We are looking at stool impaction. It's this specific, highly painful digestive trap where waste literally gets physically stuck inside the rectum. And I'm telling you, understanding exactly how this happens, and more importantly, how to step in and intervene, that could literally save a life today, yours or someone you love.
We've got a really solid roadmap planned out for today. 1. The anatomy of a blockage. 2. 4 misleading symptoms. 3. Recognizing an emergency. 4. The at-home rescue protocol. And finally, 5. Long-term prevention.
All right, let's jump right into section 1, the anatomy of a blockage, and how waste essentially turns to clay.
You know, most people treat digestive issues kind of like a leaky faucet. They just ignore it, throw a bucket under it, and hope it eventually goes away. But a fecal impaction, that is not a leaky faucet. It is a seized pipe. Think about it. Your large intestine is basically a 5-foot-long tube, and its primary job is to absorb water from waste. And it is brilliantly efficient at doing exactly that. But when stool just sits in the colon for way too long without moving, your body doesn't actually know to stop extracting the moisture. So day after day, it just keeps pulling water out, turning what used to be soft waste into something with the literal density of hardened clay. Imagine trying to force a huge, rough stone through a regular garden hose. Pushing harder doesn't help. It literally just wedges the whole mass deeper.
And 60 is often the critical age when a perfect storm of biological changes hits us. First off, those natural intestinal muscle contractions, they start to slow down. The perception of pain in your gut actually dulls, so you might not even feel the normal urgency to go in the first place. On top of that, your natural thirst reflex weakens, which leads to chronic dehydration that your body barely even registers. And then, mix all of that with the fact that seniors are frequently taking medications, things like blood pressure drugs, pain meds, antidepressants, iron supplements, that literally stall digestion. It's really important to know this isn't your fault. It's just a major physiological shift.
Moving on to section 2, 4 misleading symptoms. This is the diagnostic trap you absolutely need to avoid.
Okay, the most dangerous diagnostic trap out there is something called paradoxical diarrhea. Now, you might be thinking, hey, I'm not constipated, I have diarrhea. But here's what's actually happening physically. When a rock-hard mass completely blocks the rectum, the newer, looser waste from higher up has absolutely nowhere to go, so it simply seeps around the edges of that solid blockage and leaks out. Do you see the danger here? People see that and instantly reach for anti-diarrheal medications. Listen to me, that is the absolute worst thing you can do. Those meds paralyze your system, they slow everything down even more, and they allow that blockage to harden and grow. Just don't do it.
And that confusion just builds when we look at 3 other really misleading symptoms. First up is urinary retention. The rectum and the bladder are anatomical neighbors. They share a very tight space in the pelvis, so a severely swollen rectum physically compresses the bladder wall, which makes urination super difficult or even completely impossible. Next is lower back pain. So many people just assume it's their arthritis acting up, right? But intense rectal pressure actually radiates outward, straight into the lumbar region, the hips, and the thighs. And finally, sudden confusion, especially in seniors. The sheer systemic physical stress, combined with that early toxic buildup from a bowel obstruction, can actually spark serious disorientation and unusual agitation. Basically, if an older loved one suddenly seems mentally off, their bowel status really needs to be one of the very first things you check.
Let's look at section 3, recognizing an emergency, the danger zone.
I need to drop the upbeat tone and get very serious for a second here. Because if this is ignored, the situation escalates predictably and, frankly, fatally. Looking at days 1 to 3, we see stage 1 ileus. This is where the stretched bowel wall, which is living muscle tissue, remember, gets stretched way beyond its natural capacity, loses its blood supply, and just goes completely quiet. Then, days 4 to 6, stage 2 colonic obstruction hits. The backup starts spreading upward. We're talking visible distension, nausea, and vomiting. And then day 7 and beyond brings stage 3, bowel perforation. Look, the intestinal wall has physical limits. When those limits are exceeded, it tears. Fecal material and bacteria spill directly into the completely sterile abdominal cavity, which causes a rapidly progressing, incredibly life-threatening infection known as peritonitis.
So, what are the absolute go-now signals? If you or someone you care for develops a rigid, board-like abdomen that's really tender to the touch, a high fever over 101 degrees, sudden, severe, constant abdominal pain, a complete inability to pass gas, nonstop vomiting, or a sudden drop in blood pressure accompanied by confusion and clammy skin, you must call 911 or get to an ER immediately. These are not wait-and-see symptoms. Go.
All right, shifting gears to Section 4, the at-home rescue protocol. Here is your step-by-step action plan you can use tonight.
The absolute first thing you have to do is put the brakes on straining. Stop. Every single time you bear down and push hard against a solid blockage, you're just cranking up that intra-abdominal pressure, irritating already inflamed tissue and risking severe hemorrhoids or rectal tears. Honestly, not once in human history has white-knuckling it on the toilet magically dislodged a hardened mass. It just doesn't work, so please stop immediately. Okay, here are your exact step-by-step rescue instructions. Step 1. Do not stand up. Lie down on your left side. This specific posture, the left lateral decubitus position, perfectly aligns the colon and rectum so gravity actually helps you out. Then apply a generous amount of water-based lubricant and insert 2 to 3 adult glycerin suppositories. Why 2 or 3? Because 1 is rarely enough to actually penetrate a large hardened mass. Then just lie still for 30 to 45 minutes to let that glycerin melt and really soak into the blockage. Step 2. If nothing moves after that first attempt in the bathroom, rest for an hour, walk around gently, drink some warm water to help relax the muscles, and then repeat Step 1. A second round is very often what finally breaks through the core of it. And Step 3, if you've gone through 2 full rounds with 0 movement, or if any of those emergency symptoms we talked about pop up, go to urgent care or the ER. Seriously, going to the doctor is not a defeat here. It's the absolutely correct clinical decision.
Now, if you do end up at the hospital, you might undergo what's called a manual disimpaction. And I really want to destigmatize this right here and now. What happens is a specialist will physically break up and remove the hardened blockage. Because the tissue in there is really inflamed, this is routinely done under appropriate sedation or anesthesia, so you won't feel pain and your muscles are fully relaxed. It is a completely safe, well-established clinical intervention, and patients constantly describe the immediate drop in pressure and pain is absolutely profound. It's just a massive relief. Moving to our final section, Section 5, long-term prevention. Let's talk about breaking the cycle so this never happens again.
We're going to rapid fire through your daily defenses here. First up, massive hydration. You need to be drinking 6 to 8 glasses of water every single day. And pro tip, drink 1 huge glass immediately upon waking up. That triggers the gastrocolic reflex, which is just a gentle, natural wave of intestinal movement. Second, movement really matters. Taking a 20 to 30-minute walk or even just doing some gentle chair exercises right after meals stimulates peristalsis. Those are the muscle contractions that actively move waste along. Third, interrogate your medications. Sit down and have an honest conversation with your doctor to see if your blood pressure meds, iron supplements, opioids, or antidepressants are slowing down your digestion. And finally, establish a consistent 5 to 10-minute morning bathroom routine. Go at the exact same time every single day to essentially train your body's internal clock.
You also really need to watch out for the hidden dangers of daily laxatives. You have to be super careful with stimulant laxatives. If those become a daily crutch, your intestinal muscle actually starts to depend on that external chemical kick. Over time, without the laxative, the colon literally forgets how to contract on its own. This condition is called cathartic colon. And let me tell you, it is way more common in older adults than people realize. If you've been using them daily for weeks on end, please work with your doctor to safely wean off them.
Oh, and whatever you do, don't forget your posture. Humans were simply not designed to evacuate sitting at a perfect 90-degree angle on a modern toilet. By just grabbing a step stool, sliding it under your feet, and raising your knees up above your hips, you completely relax the puborectalis muscle. That's a little sling-like structure that creates a natural kink in the rectum. This one incredibly simple change dramatically eases the physical mechanics of evacuation, which is a total game changer, especially for seniors dealing with weakened pelvic floors.
Look, caregivers are very often the first ones to notice these subtle warning signs in elderly or immobile loved ones, so be proactive. The conversation may feel totally awkward at first, sure, but the consequences of silence are far, far worse. Protect yourself, protect your loved ones, and take back control of your digestive health. Thank you so much for